imagine somebody walking into this urgent care center right here in Airdrie and wanting to and needing more support than they can be provided here. And the ambulances in this community are away in neighboring communities or in Calgary. You can just imagine the distress and the upset.
Concerns raised in communities surrounding Calgary as new numbers show a skyrocketing increase to how many times ambulances are being redirected from Cochrane, Airdrie, Chestermere and Strathmore into Calgary to help respond to emergencies there.
If an Albertan is in distress, of course, the nearest available ambulance should respond immediately, regardless of where that Albertan lives. That's been happening routinely for many years. But the longer a community needs to divert its ambulances to other communities, increases the risk that an ambulance would not be available to arrive in its own community when needed.
A Freedom of Information request filed by the Alberta New Democrats show over 30,000 instances of ambulances being pulled from those communities and sent to Calgary, most of which were over the last year. Last week, data from Alberta Health Services showed Calgary had no ambulances available to respond to calls an average of 400 times per month throughout the first 6 months of this year.
We really need there to be a properly resourced EMS system in this province, and the paramedics have given 3 ways that actions that can be taken immediately for that to happen, and we need the UCP government to step up and listen and take action.
In a statement to City News, AHS says it's working hard to make sure ambulances are available in all communities when needed, and a new initiative launched earlier this year has shown success in reducing the number of suburban responses into Calgary by about 50%. In Edmonton, Saif Kaisar, City News.